Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Saturday, November the 7th. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh peoples. We're honored and thankful to them for allowing us here today. We're obviously having this briefing today. We'll be having another briefing on Monday at 3 o'clock in the Press Theatre in Victoria. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. This is another challenging day for us here in BC. And I will start by announcing that we have 567 new cases reported today in British Columbia of COVID-19, bringing our total to 17,716 people in BC who've been diagnosed with COVID-19. The new cases include 122 people in the Vancouver Coastal Health Region, 411 people in the Fraser Health Region, 3 people on the Vancouver Island Health Region, 22 people in Interior Health, and 9 people in the Northern Health Region. We now have over 100 people who are in hospital, 31 of whom are in critical care or ICU. In addition, we have 1 new healthcare outbreak, the residents in Mission. So we now have 37 active outbreaks in our healthcare system, in 33 in long-term care and 4 in acute care sites. This abbreviated numbers that we have today is the reason we are having this discussion and this briefing today. As you know, in the last 2 weeks, we have seen dangerously high and rapid increase of COVID-19 cases and outbreaks affecting primarily our healthcare system, but also many other places in this across the province, but particularly here in the Fraser Health and Vancouver Coastal Health regions. We are also watching what has happened around the world, and we are not alone in seeing this rise in cases. We have seen them in jurisdictions all around us and around the globe. We have had transmission in a numbers of workplaces where the virus has really accelerated, including fish processing, food processing facilities, some retail locations, places like car dealerships, indoor group physical activities, and other places around the province, but particularly concentrated in this region. We have had many episodes of transmission in people's homes over the last few weeks, as we know, and we have talked about this. We've also had transmission in healthcare facilities across the Lower Mainland. The result is that we are seeing a steady increase and worrisome increase of people with serious illness requiring hospitalization and intensive care. From the outset of our pandemic, the goal of our COVID-19 response has been to maintain capacity within our healthcare system so that we can support and care for people not only who are suffering from this virus, but for all of the other healthcare needs that we have. To protect those who are most vulnerable, particularly now we know our elders and seniors, as well as to keep as much as possible going in our communities, because we know that as well has effects on our health and well-being. We need to keep our essential services and essential activities from schools to workplaces open and operating safely, and right now this is in jeopardy. As a result, we will be taking further actions, and we must now step back from our restart activities. We need to take urgent and focused actions here, in particular, in the Vancouver Coastal and Fraser Health regions, to avoid the serious consequences for all of us, not just in this region, but around the province. Today, I am putting in place new provincial health officer orders for all individuals, places of work, and businesses in communities within the Vancouver Coastal and Fraser Health regions, with the exception of the Central Coast and Bella Coola Valley. The orders will be in effect for the next 2 weeks, from today at 10 p.m. through to Monday, November 23rd at 12 p.m. This will give us a chance to stop the transmission, to have a break in that rising transmission rate that we are seeing. And we need to focus our attention on that now. The order will focus on 4 areas, or the orders: on social gatherings, on travel, on group physical activities, on indoor group physical activities, and on workplace safety. Right now, it is very important that everyone in these areas of Vancouver Coastal and Fraser Health significantly reduce their social interactions. We also need to better manage indoor group physical activities where we have seen rapid transmission of this virus. We also are requiring all businesses and work sites in this area to revisit and ensure strict adherence to COVID-19 safety plans and adequate COVID-19 safety plans. And we will be working with WorkSafe BC, with our public health inspectors and our bylaw officers around this region to facilitate that. I know this is hard. I know we don't want to have to be doing this. And we need to support each other right now to make this break. We appreciate that this takes a sustained daily effort, and these efforts are critical to keeping our businesses, our schools open, and our community safe as we go into winter. So today's orders include, in more detail, for social gatherings, there are to be no social gatherings of any size with anyone other than your immediate household. This includes indoor gatherings of fewer than 50 people, even in controlled settings. So it supersedes our mass gathering order that we have had in place for some time. Funerals and weddings may proceed with your immediate household, but there are to be no associated receptions inside or outside your home or at any public or community-based venues. This is a time-limited order, but this is what we need to do now. We need to stop our social connections where we unfortunately are seeing this virus spread, and spread to those that we are closest to and that we care most about. For travel, we are strongly recommending that travel into and out of areas of Vancouver Coastal and Fraser Health should be limited to essential travel only. Those who live outside these areas should not visit unless it is urgently required or essential, and travel through only when needed. In addition, travel for sports into and out of this region is suspended for this period of time. In terms of group physical activities, this unfortunately is an area where we have seen spread in multiple different settings. As of today, businesses, recreation centers, or other organizations that organize or operate indoor group physical activities must stop holding these activities until updated COVID-19 safety plans are in place so they can be held safely. And these need to be approved by our local medical health officer. This includes spin classes, yoga classes, group fitness, dance classes, or other group indoor activities where people are increasing their heart rate, and we have seen repeatedly, not just here, but around the world, that these are venues that we see rapid spread of this virus, even with people who don't recognize that they are ill. Indoor sports where physical distancing cannot be maintained are suspended for these 2 weeks. This includes no indoor competitions or games for this short period of time. These activities can be replaced with individual exercise or practice and drills, as we did before we started phases of our restart of sports programs. And that allows everyone to maintain safe physical distancing while participating in these important physical activities. And I will note that this is not applying to physical activities that are part of a school-based program. We also need to pay strict attention to increasing physical distance off the field of play. So areas like on the bench, or when we're warming up ahead of time, or in some cases where there's spectators. And our advice has been for the last few weeks that we need to reduce and or not have spectators, particularly at children's games, whether they're inside or outside. For workplace safety, all businesses and work sites must conduct active in-person screening according to our COVID safety plans for their workers on site now. We must go back to those plans and reinforce the importance that they have. Workplaces must ensure that all workers and customers maintain appropriate physical distancing, wear masks as appropriate, and be especially vigilant in small office spaces, in break rooms and kitchens. This is where we're seeing people transmit the virus to each other in our work settings. We also know that in some work settings, places like restaurants, when COVID safety plans and the new restrictions, reducing the hours, making sure that we have physical barriers, small numbers of people, that we don't see transmission of this virus. But we do see it when those plans are slip or when they're not being followed and adhered to religiously. And right now, we have to go back. And if we cannot maintain those plans, then local medical health officers will shut those businesses down. And we have seen that happen. And it may need for people, if they feel that they cannot maintain those COVID safety plans in a restaurant, then looking at other options like takeout only. In addition, we need to consider going back to actively supporting people working from home from certain businesses, if that is possible. Businesses, we will be, as I mentioned, increasing active inspections with Public Health, WorkSafe BC, and our bylaw officers in this local area. And we know that this has been hard for businesses. We have seen measures slip in some businesses, and that has led to transmission. So now is the time for you to re-look at your COVID safety plans, to go to the WorkSafe BC website, to update the plans, and to reinforce them. And if you are a worker, you need to look at those plans and make sure that you're adhering as well. We need to redouble our efforts, as we are seeing multiple places where this is being transmitted within those settings and then spill over into healthcare settings, into our families, into our communities. We know that some of the facilities that provide these group physical activities, for example, have already taken steps such as screening participants, reducing density, increasing spaces, putting in physical barriers. And we know that some people have been doing a good job on that. What we are doing is looking at the literature around the world and what we know is safe, and we will be revising and updating the guidance from Public Health and from WorkSafe. And we will be working with the communities and each business and group to make sure that when you have appropriate safety plans in place, you can reopen. Finally, I'm also going to order that party buses, group limousines, and other perimeter seating vehicles, which is the technical names, are ordered to stop operating until further notice, effective immediately. As you know, provincial health orders are always a last resort. But right now, these additional measures are needed. They are needed here in this community, in Vancouver Coastal and Fraser Health regions, and I'm working very closely with our public health teams, our medical health officers in these regions to make sure that we can support all of the needs that we have in this community to keep everyone going and functioning with the essential services that we have. We need everyone to help us to keep this wall strong. We know that we need now to redouble our efforts to protect our hospitals, our schools, our families, our workplaces, our communities, and our elders. And now is a time that we need to do this. Despite being tired, despite the uncertainty, despite what has been happening for the last few months, this is the road we must walk. And right now, and we must walk it together. We need now more than ever to support our local businesses, our local schools, our local communities, and our own families. This virus has shown us that it doesn't recognize any of our geopolitical, social boundaries, and that we are all in this together, and we will come through it together. We will get through these challenges. We have flattened our curve in the past, and we will do it again. And it's going to be a challenge for all of us, but we must do it together. This next 2 weeks will be critical for us, and I'm calling on all of you to do this together, to do our part, and to remember how important it is to do this by being kind to each other, by staying calm, and by being safe. Thank you.
Thank you very much, Dr. Henry. And first of all, I wanted to start by expressing my condolences to the one person who's passed away from COVID-19, or to their families and friends and caregivers of the one person who's passed away from COVID-19 in the last 24 hours. We know for this family and for those caregivers, like in the case of the 273 people who have passed away from COVID-19 up to today, that this is an extraordinarily difficult time. It's a difficult time to grieve, and we are thinking of them, of that family today, and of all those families today as they deal with their grief. Over, as Dr. Henry has said, 567 cases of COVID-19 today. And just to put that in context, as you know, in the last 2 weeks especially, we've seen a significant increase in COVID-19 across our two Metro Vancouver and beyond health authorities, the Vancouver Coastal Health Authorities and the Fraser Health Authorities, from Chilliwack to North Vancouver and West Vancouver. Yesterday, an all-time high number of cases of 546. Today, in those two health authorities, 533 cases. Hospitalizations have risen to just over 100, and while this is below the peak in the early part of April of 149 and well below our capacity to address it, nonetheless, it reflects the severity of COVID-19 in our province. In addition, I would say yesterday, and this is particularly important to Dr. Henry and myself, there were 7 health facility outbreaks declared in 24 hours from Thursday to Friday. There is one further one today, and this is a matter of serious concern to us. As all of you know, the level of COVID-19 and the response to COVID-19 and the levels of mortality and transmission have consistently been lower in British Columbia than other jurisdictions across North America and indeed across the world. That even in the last week, our rolling average of cases, a daily average of cases, is about 8.5 per 100,000 here in British Columbia, and that compares to, for example, 108 in Belgium, or 97 in Switzerland, or 70 in France, or 30 in the United States. That said, we need to take urgent and focused action now to significantly bring down the rate of transmission across our two Metro Vancouver health authorities. Not doing so will have serious consequences for all of us, independent of our age, if our health care system in the Lower Mainland cannot provide the quality of care needed to respond to accidents, to surgical and medical care due to increased sickness rates among healthcare workers, or excessive demands on inpatient beds. And that's why the actions announced by Dr. Henry are so significantly important. I want to note, and to continue to note, that the most intense public health effort of our lifetime is underway in British Columbia to keep us safe from COVID-19. The effort is massive in its size, scope, and commitment. Its importance is crucial to all of us. So is our ongoing individual duty, of course, to stop the spread and keep one another safe as we enter a winter of COVID-19. As all of you know, we have seen very little evidence of influenza so far, but we are expecting and we are entering respiratory illness season, and that will present continuing challenges for all of us. As I noted on Thursday, we have now hired an additional 580 total contact tracers, surpassing the initial target of 500 first announced in August, and provided approval to increase the total number of contact tracers to approximately 800 additional positions. We currently have 78 candidates in the offer process and over 300 candidates in the interview stage. In the Fraser Health Authority alone, we have added 259 contact tracers in the past 2 weeks and have approximately an additional 200 in progress. In the past week, we've increased our overall daily lab testing capacity from 16,085 to 18,633, and will exceed our target of 20,000 by the middle of the month. I want to send a message of deep gratitude to those healthcare workers providing services directly to patients, as well as those behind the scenes who are working incredibly hard to keep us safe and our healthcare system safe and operating fully. It is up to all of us to take the necessary steps directed by the provincial health officer to substantially reduce transmission in the Fraser Health Authority and the Vancouver Coastal Health Authority in the next 2 weeks. The pandemic is tough on all of us, but we will get through this, and there is indeed hope on the horizon in the new year with potential vaccines. But right now we need to take action. No ifs, ands, or buts. The time is now in Metro Vancouver, in Fraser Health, in Vancouver Coastal Health. Full on, full in, everyone. For those who live in the rest of the province, you need to keep your guard up and double down on the actions that we know will keep us safe in our home and in our workplaces, in our communities. I will repeat again, the virus does not follow geographical boundaries. It does not care about how nice we are. It lives to transmit, and we must, in this time, do everything we can to avoid this. I want to say something finally, and in particular, to people living in the health authorities outside of Fraser Health and outside of Vancouver Coastal Health. We have today more active cases in the Interior Health Authority than we've had during this pandemic. Nothing like the rise in cases we've seen in the area around Vancouver and Fraser Health, but still significant cases. We've seen in other jurisdictions who've had very few cases and seen that change very quickly. In Northern Health, we've seen significant outbreaks in the Northwest area, in the Central area, in the Northeast area. We have in Interior Health. We've seen outbreaks on Vancouver Island. And so what is required now is to remember the provincial health orders that are in place and to follow the guidance and to follow the orders. This is a worldwide pandemic, and we need to address it everywhere in British Columbia. In BC, we can turn the tables on COVID-19 by not turning on each other. We need to turn our trend around, and we need to support each other, all of us. We must not give up or lose purpose or hope when others stumble. We must fight COVID-19, and we must fight it harder than at any time so far. Let it be said here and now that the worst of the pandemic can and will bring out the best in each of us. Aujourd'hui, nous annonçons 567 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 17 716 cas en Colombie-Britannique. Il y avait un nouveau décès lié au COVID-19 hier à aujourd'hui. Nous continuons à offrir nos condoléances aux familles et aux proches des 274 personnes qui ont perdu la vie durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, plus que 100 personnes sont actuellement hospitalisées, dont 31 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. And a reminder to the media to please press *1 to line up for questions. We will be taking one question and one follow-up this afternoon. And please do not mute your phones. You will not be heard until I call your name. We begin today with Craig Takuchi, Georgia Strait.
Can I just clarify
Yes,
something,
absolutely.
I guess, before we start on the questions? Just to clarify, the orders that are put in place today are regional orders, so they are provincial health officer orders that will be in effect in the affected areas here in Vancouver Coastal and Fraser Health. I understand there was some confusion about that, so just to make that clear.
Thank you, Dr. Henry. And the first question is from Craig Takuchi, Georgia Strait.
Thanks for taking my question. Dr. Henry, I think at the last modeling update, you mentioned that the case numbers in BC were increasing in a linear fashion rather than exponentially. Has that changed? Have we reached an exponential growth? And are there any specific areas or regions of BC that are increasing exponentially more than others?
Yeah, and that is exactly the reason why we're here today. Yes, we were seeing linear growth, which was concerning but controllable. And in the last 2 weeks, we started to see rapid increasing growth, so more exponential growth, particularly focused in the Vancouver coastal Fraser Health regions. And that's the reason why we're taking these additional actions to address that rapid transmission and rapid increase in numbers of people being affected here in this region. And we will on Thursday be presenting again the monthly update in the numbers and the modeling that we've been using that has shown this to be the case here.
Do you have a follow-up, Greg?
Yes, please. Thanks. The number of people that are being monitored by public health has been continually and rapidly increasing. And I know that there have been some jurisdictions that have stopped contact tracing because the numbers were so large it was no longer useful or possible. Would you be able to say where we are in relation to that type of situation?
Yeah, another very good question. And one of the reasons, again, while we're taking these actions today, we have been able to continue with our aggressive and very pinpoint contact tracing and our case management, so identifying where people are being infected. And that is what has helped us understand the scenarios, the settings where we're seeing transmission to larger numbers of people. So these measures that we're taking today are to try and reduce those numbers that we're transmitting to, that people are transmitting to. We now have community transmission in this area, which is at that point that even small groups, we can get rapid transmission to larger numbers, and then it gets multiplied from there. So yes, we are still able to manage, and with the additional contact tracers that we started hiring earlier on in the summer when we were having a bit of a lull, because we knew that this was going to be incredibly important for helping us keep things open that are supportive for our communities and our society. So right now, yes, in Vancouver Coastal and Fraser Health, we are still doing contact tracing and case management of every single case. And that is why we need to take these actions for the next 2 weeks to get those numbers back down again, to reduce our numbers of contacts so that if we are carrying this virus, we're not spreading it to the 15 or 20 people that are in our spin class or in one of our indoor activities centers or in our workplace.
Thank you. The next question comes from Amy Smart, Canadian Press. Amy, are you there? Okay, moving on. The next question is from Simran Singh, Daily Hive. Simran, go ahead, please. Simran, can you hear me?
Okay, is it our problem or the line problem?
All right, we'll move on. The next question is from Imad Agahi, CTV News. Imad, are you there? We just might be having a little bit of a technical issue here. Media on the phone, please do bear with us. We're just trying to fix a technical issue.
I'd sing, but that would scare everybody off. Looks like we might have something.
Audio check, 1, 2. Audio check, 1, 2.
Ladies and gentlemen, please stand by. We will begin again shortly as soon as we get the feed line reconnected. Hi, this is the operator on the alternate feed line. I pulled you out of the conference. I hear that you're hearing me back through when I speak, but we're not hearing anything from you.
Operator, not hearing me at all now? Audio check, 1, 2.
I'm hearing you in the background somewhere. Not at the microphones that
What about
that's coming
here?
through the system.
Audio check, 1, 2. You have me there now?
And can you hear me?
I hear you, Shruti, but it's in the background somewhere. It's very quiet.
Oh.
It's like you're away from whatever microphone is actually picking up.
How about here? Can you hear this one?
Doctor, I'm hearing you, but it's not loud and clear. I'm not sure where the pickup is for this. We could proceed if you speak a little loud. Could you just do a test for me?
Sure. How is this for a test? Can you hear here?
We can hear. It's not the best. If you spoke a little louder, it would be better. That was what I would suggest. We've got some background noise on this mic.
I'm not sure that's my style.
I understand.
No, I can
Well,
try.
we could begin
I'll
from
speak
here.
louder.
We could continue.
Is it recorded sufficiently loud?
Yes, generally speaking, yes.
Okay. Okay.
Check 1, 2, 3. Is that okay now?
Okay, so the media is still on the line. They are standing by, and we have made an announcement to the whole, and we can continue.
All right. Thank you so much. So we'll start again.
Okay, stand by.
Thank you.
You don't have to start again. You can, we're at the question point.
Yes.
That's where it drops off. So stand by, please. I will indicate to you when we're back in the mode ready to go.
Thank you so much.
Thank you. One moment.
You are now rejoining the main conference.
Is it good to go now?
Yes, thank you. Please continue.
Okay. So the next question comes from Amy Smart, Canadian Press.
Okay now?
Yes.
We can hear you.
Okay, great. Wonderful. I was just wondering, I know, for the course of this pandemic, you've really taken a province-wide approach. Obviously, we're seeing more cases now in Vancouver, Provincial Health, and Fraser Health. But with cases still increasing elsewhere, like in the north, I'm wondering why you didn't choose to apply these restrictions across the province.
Yeah, this is something that we have had ongoing discussions about. We do have PHO orders that do apply across the province, the most recent of which was around social gatherings in one's home, and those continue to apply. And, in discussions with my public health colleagues in other parts of other regions, we feel that we are able to manage the cases, that we know where the clusters are coming from, and that the measures that are in place there are working. We're not seeing that rapidly increasing numbers of cases like what we're seeing in this region. And geographically, this is a region that there's a lot of movement back and forth between Vancouver, Surrey, Chilliwack, the lower mainland region, and that is where the focus of this activity and where the amplifying of the outbreaks is happening. So we made the decision that we needed to take time-limited additional measures to reduce that rapidly increasing transmission rates here. It does not mean that we're out of the woods and that we can back off in other areas of the province. It just means we need to keep holding the fort there, continuing to pay attention and do the things that we need to do there.
Do you have a follow-up, Amy?
Yes, thanks. I know you mentioned the exemption of the Central Coast
That's correct.
Can you tell me why those are exempt?
Yeah, so the Central Coast and the Bella Coola Valley are geographically quite different in terms of where people travel back and forth and their interactions and things like health services, where they are more closely aligned to some of the lower risk areas in the province right now. So it made more sense to not include them in these orders to allow for ongoing, what's the right word? So the catchment area for healthcare, for example, is more closely aligned with interior health region. So we didn't want to put in barriers that were not necessary in those areas.
Thank you. And the next question comes from Simran Singh, Daily Hive.
Hi, my question is for Minister Dix. And maybe Dr. Henry, you can help me here too. From my understanding, there was a meeting between Premier Horgan and influential members and residents in the Fraser Health community yesterday. I'm just wondering what were the key takeaways from that discussion, and how are you really working to further cultural care in that particular region, and what are you going to do with the information you received from residents and influential voices yesterday?
So I cannot comment on that meeting because I don't have any knowledge about it, but I can tell you that I have been working, and Minister Dix as well, but we have been working with our Fraser Health colleagues and have had a number of conversations with local media, but also with key people and influencers and healthcare providers and others in the Fraser Health region. As you know, we have had an increase in cases there related to a whole bunch of different things. We've talked about this a number of times over the past month or so, and even into late summer where we started to have a steady increase. So we have been doing outreach in different cultural communities, ethnic communities, and different geographic communities in the Fraser Health region.
Yeah, thank you very much for your question. That meeting is one of about a dozen I've had with people in Fraser Health in the last period to talk about how we can better communicate and better work together to see that the guidance of Dr. Henry is followed everywhere in the province. And so we've been, that particular call I think you're referring to is with leaders in the South Asian community, but we've had similar calls with leaders from other communities, and both in recent periods and before. I would expect, for example, on Monday you'll see a renewed media campaign from the government on some of these questions, and as it builds out in multiple languages, I think. But what the message there was, and the message at every meeting is that we can all be better influencers, better teachers. We can all lead. We can lead in our household. We can lead in our communities. We can lead in multiple languages. We can lead by following and by, in a sense, showing how and working together on how, for example, at a time of celebration of life when we can't get together, how we can support people who are grieving, how at a time when we can't get together that we can celebrate events such as Diwali or Christmas, how we can, in a time when we can't get together in person, how we can continue to support one another through the really real and profound mental health and social challenges brought by the pandemic everywhere in the world. So there were lots of takeaways, and I've been doing both a lot of talking but also a lot of listening to people as to how we can better communicate that message. In May, as you know, we conducted a survey of 300,000 British Columbians that was filled out in multiple languages at that time to hear from people how we better communicate. We've got to continue to do that effort. So I expect you'll see some of those takeaways taken away, but mostly by us in terms of how we deliver the message, but also what we're doing is enlisting everyone, and I want to repeat that today, everyone, to be leaders on our core messages, that right now we can't gather together in private homes. We just can't do that. How we have to continue to wash our hands and stay socially distant, how in our workplaces we can keep our customers and our co-workers safe, how we can do these things, and why it is necessary, because it is so important that our hospitals and our surgeries continue to work at full capacity, that we continue to ensure that our elders are safe in long-term care, that we continue to have classroom education and businesses operating and people working. These are the values and the things we want to do. And so I was very moved by the presentations on the call yesterday, as I have been on the multiple calls I've been on in the last weeks and months. And we're going to continue to work with people. We're going to continue to talk, of course, but we're also going to continue to learn how we can better deliver the message. We can all be better better leaders and better teachers, and I take away a lot from what people tell me every day by email and in meetings.
Do you have a follow-up, Simran?
No, I don't. Thank you.
Thank you. And the next question comes from Keith Baldry, Global News.
Hi, Dr. Henry. Thanks for this. Fraser Health has had 400 cases test positive in the last 2 days each day. I know the goal is to keep schools open. If we continue at 400 cases a day in Fraser Health, can schools in that region be expected to still be open on a safe basis? I know we don't have a lot of transmission in schools, but is 400 sort of a danger level there for that?
Yeah, so obviously schools are one of the things that we want to protect because we know how important it is for teachers, for students, for families to have schools operating. And what you say is exactly right. We've had a number of exposure events higher in those areas where there's higher community transmission. This is something we know. If there's more, what happens in schools reflects what's happening in our community. So that's why the focus is on reducing transmission in our communities. What we have not seen is a lot of transmission events in schools. Schools are not amplifying this virus. They are merely reflecting what's going on in the community. And so, yes, we need to make sure that we're taking those precautions. If we are a teacher or a student and there's people in our family who have COVID, we need to stay away from school. And that is working. What we are seeing is that the plans that are in place in our communities, in our schools, are working to prevent transmission, and public health is working very closely with schools to make sure that that continues.
Do you have a follow-up, Keith?
Yeah, it's just more of a clarification because I'm getting already questions from people on Twitter and colleagues. What impact does this, if any, does this have on kids' minor indoor hockey?
Yeah, so minor indoor hockey, those are some of the things, some of the sports teams that we're looking at. We need to take a pause in this region right now and make sure that these can continue, but we're not having games across regions. We're not traveling with hockey teams or other sports teams, that we take a step back and make sure that they're able to do this safely. And I will also say that we need to focus right now. We talked about this a few weeks ago that we need to make some decisions given that we're in a very unusual year with this pandemic. And that may mean that we don't play on multiple hockey teams or on multiple sports teams. And if we're involved with school sports, then we may not want to be involved with sports outside of the school setting so that we keep those potential connections small. The other things that are really important are the non-game field settings where we have seen people get together, whether it's parents or the players themselves on the bench, in the locker room, afterwards, when families are getting together. We have seen transmission happen in those settings as well. So the off-the-field to play settings. We have a working group that's been working with Via Sport, for example, here in BC, and the amateur sports agencies with the public health teams at BC CDC and from their regions that have been looking at sports in particular, and they will be supporting this region in making sure that they can take measures that keep all children safe. We know how important it is to continue with physical activity, so we don't say stop at all, but what we need to say is for this next 2 weeks, we need to take a step back from some of the reopening, and that there's no travel for games, and that we focus on keeping kids active in a safe way.
Thank you. The next question comes from Imad Agahi, CTV.
Hi, thanks for this. And my first question, Keith had asked, so let's get right at the second one. Now, with this new order, what happens to people who live alone, perhaps, and have really been limited to the safe 6? Does that now go down to the safe 0?
No, I hear you. It's very challenging for those who live alone. And yes, those are where you can have those very small number of people who are in your bubble. So it really is about looking at your household and the connections that you have and reducing those social connections where we have larger groups of people, and we've talked about going down to 6. For some people, that is a lot, and for many people, it's that have large households. That may be way too many. But now we need to scale those back. So it means if you do have 1 or 2 people that you are close with, that you are considering your family, your bubble, your household, then stick to those people.
Just one small point to say that, when at the beginning of the pandemic, we started a program that the colleague and the seniors advocate, Isabel McKenzie, helped lead with members from all the political parties and involved the United Way and Better at Home. And what it intended to do was address issues of social isolation. And we're obviously continuing with those efforts. This is a 2-week period. And what I'm asking people to do, in addition to all the other things that we're asking people to do, is to reach out to people via phone, via FaceTime, people who might be in the circumstances you're describing, and provide them with support at this time. We know, and one of the reasons we're taking the kinds of actions that are being taken today is to ensure that those kind of other impacts that happen with respect to COVID-19 don't happen in this period. So while we can't get together in person, I would like everyone to reach out to someone they know or someone they love, or maybe only know a little bit, who might be isolated, and reach out in these times and talk more and be available more on the phone and via the internet and other means, so that we can get through this period together and support one another in these times. I think that's what British Columbians have done extremely well from the beginning of this pandemic, and that's what we have to do now.
Do you have a follow-up, Ahmad?
No, thanks. That's good.
Thank you. The next question comes from Gordon Hextra, Vancouver Sun.
Thank you for taking my question. I'm just wondering, there are some jurisdictions, countries like Australia, which have taken some more restrictive measures, like, actually closing borders to outside travel, including within states, and then also places like South Korea, which have used, tracing apps, which maybe has a little bit of a invasiveness to it, to really knock down the numbers, like to, orders of magnitude lower than they are right here in British Columbia. Is there any consideration to taking those kind of measures to get this under control?
Yeah, so we have always looked at what measures seem to work, and we know what measures work here. They have worked before, so we are taking a measured approach. Very aware of what happened in Australia. We've been watching very carefully there. It is a lot easier when you are an island to control movement back and forth. And we talked about that at some length about, should this be across the province or in the areas where we're seeing this mostly. So I believe we're taking measures that will work in the areas where we need to pay attention right now. We always are looking at, do we need to do more? When can we back off? When can we allow things to open up again? In terms of apps, Korea, I've been on a number of calls where they've talked about the issues and how they use their app or not. And it's not a tracing app, it's a notification app. And we, right now, the way our processes are working, we don't feel it would be helpful to add that sort of an app in, although we are leaving the door open. We certainly think that there are areas where it could assist in notifying people, and I've said this a number of times, but places like if we go to bars or parties, and of course right now in this area we're not doing that. So we need to take account to these measures and make sure we're doing what we need to do right now to keep as much as we can open to support our communities here.
Follow-up, Gordon?
I do. Just wondering, just a little bit of clarification on is it a recommendation that people don't travel outside their health region borders, or is that an actual order? I'm just wondering, like, for example, like with BC Fair Evenings, does that mean that you actually aren't allowed to take a ferry to Vancouver Island if you live in Fraser Health or Vancouver Coastal Health, or is that just a recommendation?
It is a recommendation in the very strongest terms that right now we need to go back to what we were doing in March and April and May, where it was essential travel only. And we recognize that there are very valid and important reasons why people have to move to different areas of the province, but we also recognize that this virus travels with people, and we bring our risk with us, and we take that risk back from where we've been. So right now, we are advising in the strongest terms that people need to stay in their local community, reduce their social interactions, and travel when it's essential.
Thank you. And the next question comes from Bethlehem Miriam, News 1130.
Hi, Dr. Henry. Thanks so much for taking my question. In terms of these new orders, how will household gatherings and restrictions on those be enforced?
Yeah, this is something that we have not always, we've not made a focus of enforcement, and we don't necessarily need to enforce it. These are the rules, and we know that people understand the rationale for the rules, and that for the most part they follow them. So we are telling people that this is the risk in this area right now, and these are the things that we need to do to protect our families and our communities and our healthcare system. And it is very important that people do take these actions now. Having said that, we do have the ability to enforce rules, and that can be done through public health inspectors. We've now also have the ability to enforce them through bylaw officers and police. But I don't believe that that is necessary. We don't need a stick for people to realize the importance of taking these measures now for this time-limited period to break those chains of transmission, to bend our curve.
Follow-up?
Yeah, I do. Many experts continue, including doctors, are advocating for collecting race-based data. They're saying that Black Canadians are disproportionately contracting and dying from COVID because they are working on front lines like factories and retail work. I mean, at this point, you've touched on this in the past. What do you think will be done in the near future? What do you think should be done?
Yeah, this is a very challenging thing, and from the outset of this, we have a way that we can link Indigenous data, and that we have been following that in particular because we know the differential impacts that pandemics have had on First Nations communities in this province, in this country. So that has been our focus. We have been working with the federal government to come up with a standard for how we collect race-based data or disaggregated data by race. The challenge that we have run into is that means additional questions on our case investigation form, and that means additional time to actually enter that data, and it has not been collected in a systematic way. And although we tried through the summer, we were hopeful we would get a reprieve and be able to add in some additional measures. That was not to be, as you know. So at this point, we do not have the capacity to add that information to each individual case report form. And we don't, frankly, have a coordinated information technology system, an IT system, that allows us to easily transmit and share that information either across the province or across the country. So we are not able to do that on our case-based investigations. We're focusing on the public health actions that we need to take for each individual person in the midst of this pandemic. Having said that, there are other ways that we can retrospectively look at the impacts of the pandemic and of the measures that we've put in place to deal with the pandemic on populations in BC. And one of the ways that we've done that in the past is the survey that we did that had disaggregated information collected that helped us understand that better. And we are looking at ways that we can, we're talking with the federal government and our provincial territorial colleagues about how can we do that by linking information with things like what we know about neighborhoods and census tracts and things like that. And I know there's been some work done in Toronto that we have very similar alignment with. So it has been very much a challenge. We absolutely believe that if you don't measure and look at those differences, that we're going to be missing inequities. And we've seen that in the survey that we did, and we are continuing to look at how we can address those issues. But we were not able to add it in a way that allowed us to continue as you can imagine, it's quite a detailed process for every individual. And there's now over 17,000 people who understand this a little better. When public health calls you, it's a stressful thing for people to either find out that they have this disease or that they've been exposed to it. There are many, many questions that people have, and our focus is on finding out how the virus is being transmitted and where it's coming from so that we can put in those control measures. So we have not added it to our case report forms at this point.
Thank you. The next question comes from Richard Zussman.
Dr. Henry, I have a few questions. I'll go through them quickly, and if you can touch on each of them, that would be great. What are the restrictions on gyms? Is it just indoor sport that's impacted here? Does it include soccer or other outdoor sports? What happens with churches and other faith groups and gatherings? Are those impacted by the restrictions? And what happens if a grandparent is caretaking for their grandchild? Can they go to their home to do that, or tutoring, or home daycares?
Sure. So what this it refers to is, so in terms of the gyms, we're talking about the indoor group activities in gyms. So there are gyms that are operating where they're doing one-on-one, or where people go in and there's adequate space and they can be on machines that are separated from each other. It's those group activities that are done in the indoor setting that we're talking about. For some gyms or businesses, that's their only model, and they need to either stop or make sure that they have in place approved safety plans, and that will be working, local public health will be working with those facilities around those. So it does apply to those group activities within a gym setting. So some community centers, for example, have a gym or where there's weightlifting that people do individually. Those sorts of things can continue. And when we're talking about the sports teams, some restrictions are on the indoor sports, and some restrictions, like restrictions on traveling outside the region to play games, are on the outdoor sports and the indoor sports. Does that make sense? What other questions? The churches, so yeah, so those are not social gatherings. Those, so the 50-person limit with this physical distancing and all of the important restrictions that have been in place around churches and other religious centers remain in place. And I will, again, take this opportunity to send my thanks and gratitude to the many, many faith leaders around this province who have been supporting their communities and their congregants in doing this safely. And I know it has been hard for many people not to come together and worship together or have their ceremonies together, but we cannot do that yet. We will be able to come together again, but it's not that time yet. So the mass gathering restrictions apply there. In terms of going to a household to look after children and daycares, the orders do not apply to those. It applies to social gatherings.
Do you have a follow-up, Richard?
Thank you for that. And last one about people visiting from outside the province. I know Gord alluded to this, but is there a restriction on people coming from outside the province to visit in Fraser Health and Coastal Health? And will you be having a conversation with BC Ferries or the federal government about imposing additional restrictions at ferries, asking people if they are traveling, if it's essential travel?
The short answer is no. We've never had restrictions on people coming in and out of the province. We have again asked across the country, we've all talked about, staying put. We're seeing resurgences in every province in this country right now, with the exception of the Atlantic bubble, perhaps. But certainly Manitoba, Saskatchewan, Alberta, Quebec and Ontario and us are in the same boat. So we are asking people not to come unless it's essential travel into this region right now, recognizing that that's where our biggest risk is. And we're asking people here not to travel unless it's essential. But no, we will not be putting in orders or restrictions on BC ferries.
Thank you, and we have time for one more question this afternoon. For everyone listening today, there will be a statement released shortly with the latest information on cases, hospitalizations and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities, and for access to provincial guidance on COVID-19, visit bccdc.ca. For information about the province's pandemic supports, visit gov.bc.ca/COVID-19. And the last question this afternoon comes from Zara Premji, CBC.
Hi, Dr. Henry. I know there's a lot of questions here and a lot of clarity we still need, but I want to ask a bit about the social gatherings outdoors and at restaurants and how that will be working and if that will be restricted as well to just our households, but in a restaurant or outside our homes, how does that work?
Yeah, so restaurants that have the restrictions in place that we have across the province here, which means no more than 6 people at a table, no table hopping, everybody wearing masks, keeping their distances, those restrictions are still in place. And we've also, as you may recall, we've limited the hours of operation and serving of alcohol. Since we have done that, restaurants that have been following those rules have not had transmission events. We are now, however, in this region, we know that the community transmission is higher. So we need to pay attention to those rules. And I know there's been concerns that in some restaurants there's been slippage of these rules, or that we as consumers in the community have maybe become complacent and feel that these rules don't apply to us. We will be cracking down on those. We know the inspectors know where the restaurants are. We've been working with WorkSafe, and we will be paying attention particularly to restaurants because we know it can become an environment where we have seen transmission to large numbers of people when these rules aren't being followed. So now's, that's a fair warning, but now's the time we need to all pull back in this region and make sure that we are following those safety plans, because when we follow those, they work. So we're not adding additional measures there. And I'm sorry, I lost the last part of your question.
It was just about social gatherings outside our own homes.
Yeah. So when we have those rules in place, then those are, but the other part of it, parties, events, right now for the next 2 weeks, those are not to happen.
Do you have a follow-up, Zara?
Yes, I do. Thank you. So regarding the indoor group fitness being shut down, what kind of changes to their plans are you looking for compared to what they've already presented right now, and when is the earliest that they could reopen?
So as I mentioned, we have a team that's been looking at the risk that has been become apparent across the world, across Canada and here in BC for some of these activities. So we know that there are some spin companies that only do that have put in barriers like people only going at the same time with a cohort of people, putting in physical barriers between bikes, for example, keeping the music down low so we're not shouting, making sure the ventilation is adequate. I know some of the spin classes have been done outside, and that is, of course, less risky. So there are things like that. We know that there's enhanced and best practices around dance studios and other indoor group activities that we need to upgrade and update our guidance on, and that will be worked on in the next few days. So the soonest that we can see people with the appropriate measures reopen will be in the coming week. I think what we have seen is that some gyms are doing this really well and some gyms are not. So they need now to really show that they have these plans in place, because we've started to see increased numbers of people that report that that's where their infections have come from. So it will be a process, and it will be a process that will take at the very least days. And for some facilities, this risk period, they may choose to stay closed.
Thank you, and that's all the time we have this afternoon. Thank you all for joining us.
Thank you.